This is Digital Health Today, episode 35.
We have a rich history of pharmaceutical companies building solutions, building services for patients, for doctors, whatever, but really not considering or not putting the end user at the heart of what they do. You know, one of my favorite quotes is, it's not building for patients, it's building with patients. That's at the heart of Fjordian thinking, to create, with humans right at the center of what you do.
Welcome to Digital Health Today, the podcast focused on the leaders, innovators and technologies transforming healthcare today and tomorrow. Find us online at digitalhealthtoday.com.
This episode is brought to you by Audible.com. Audible is offering a free audiobook download and a free 30-day trial to give you the opportunity to check out their service. With over 180,000 titles to choose from, you're sure to find something you like. Enjoy your free audiobook and 30-day free trial courtesy of Audible. Sign up today at digitalhealthtoday.com/free. Hello and welcome back. This is Digital Health Today, the place to be to get the insights of leaders working to make the healthcare of tomorrow available today. I'm your host, Dan Kendall, and this is episode 35. In this episode, I spoke with John Pugh. John is the health and life science team leader for Accenture. He describes himself as 100% digital innovator and wholly committed to transforming the life science and healthcare industry. He's here to tell us what he and his colleagues are working on in the fields of artificial intelligence, analytics, blockchain, innovation, and more. We also dive into the program he's heading called the HealthTech Innovation Challenge and how startups and corporations can participate and benefit. We also talk about some of the information and resources that Accenture has produced and made available to businesses and organizations of all sizes. Before we jump into that, I just wanted to give a couple of quick reminders. This episode is going live on July 25th, which means that we're 5 days into the industry access period of the brand new .health domain extension. As a benefit for members of our digital health community, the company behind .health has set up a special access page where you can get accelerated access to the .health domain you need. To learn more about this and what it means for your organization, take a listen to episode 33 where I spoke with Jen Lannon of .health, and check out the show notes with a link to the accelerated access, and you can find that link on digitalhealthtoday.com/33. Just to clarify, we don't receive any royalties or payments if you do decide to purchase a .health domain, but I did want to make sure to remind you about this important opportunity to get a unique address for you and your business on the web. Also, we did set up our own site on the .health domain to showcase the various digital health companies and solutions that exist around the world. Head over to today.health and set up your profile to add your product or service to our website and connect with the people who can use your product. Speaking of connecting with people, let me tell you more about today's guest. As I mentioned, John Pugh is the Health and Life Science Team Leader at Accenture, and he's based in the Global Center for Innovation in Dublin, Ireland. John started his career in the music business and got involved in the tech scene when he joined a startup in 2000. He's here to share his perspective on collaboration, innovation, and how creativity can thrive in a constrained and regulated environment. He also shares some insights into the HealthTech Innovation Challenge and how it can help startups and corporates shape the future of health through collaboration. Now, I do need to apologize slightly for the audio quality in this episode. I always strive to provide good quality recordings, but as in all things, technology occasionally comes up short. John and I covered some great insights on this call, and because of the time-sensitive nature of the HealthTech Innovation Challenge, the application deadline is September 1st, we didn't have time to re-record the entire episode. So please bear with the audio quality on this call, and I'll continue to provide high-quality audio on future episodes. As always, you can get all the notes and links from the show on the website. Just visit digitalhealthtoday.com/35, and you'll find the links to the resources Accenture has made available free of charge, as well as some videos of John and some of the companies he's mentioned that are from the Startup Health Festival held in San Francisco in January 2017. While you're on the website, please take a moment to join our digital health community, and I can't wait to welcome you there. Now let's tune into the conversation with John Pugh. John, thanks very much for joining me, and welcome to the program.
Happy to be here. Thanks very much.
John, I've given the listeners a little bit of background. Can you tell me a little bit more about your personal journey that got you to where you are today?
Absolutely, yeah. Going way back, I started off my career as about 7 or 8 years. I was working in the music industry. So I was a music journalist and a radio presenter and an A&R scout. And then from there, that kind of evolved into working at a tech startup company, which was largely because I started writing for a couple of online publications. And that kind of got me into the internet, and I was touting for work and stumbled across one of my friends from school who set up a startup company. This was back in 1999, so this was the first wave of startups. We weren't even called startups back then. We were just called, it was new media companies. And that lasted until about 2002. during which time, and that was a company called Do You, which was all about consumer reviews, consumer opinions. This is, predated Amazon. And so back then, the thought of people actually, writing reviews about products and services was borderline crazy. And we learned so much about online marketing, SEO, price comparison engines. We developed a price comparison engine, all sorts of different things like that. And so when we ran out of money, I was looking around and just applying for a bunch of different jobs. And one of them was a pharmaceutical company based out in Bracknell, who were just looking for someone to help them figure out how to use the internet. And so I went in there and met a wonderful guy called John Pearson, who actually had a similar background in terms of, very passionate about music. And I instantly got a rapport going with him. And that was my introduction to pharma. So that was Boehringer. I ended up being there for 13 years. So 13 years later, here I am at Accenture. I've been here almost 2 years.
I think it's really interesting when people start in something that's completely outside of healthcare and come to it, especially with a journey like you've taken from music to price comparison site. And I think it's great to talk about what the internet and what the world was like before we had Amazon and Yelp and all sorts of ways to access information about what's happening around the world. What was that experience like when you were at Do You? What were some of the challenges you guys were facing back in the early days of the interwebs? And what did you learn from that experience?
Well, my role was director of content. So I was responsible for all the content on the website and the community. And back then, the concept of community was a new thing really for the internet. There was no rule book. There was no real sort of prescribed way that you would deal with it. But what I learned from there, and in a way, it was kind of a precursor for social media in that, we responded to the community. There was a two-way thing. We invited the community into the offices, and we used to have meetups with them. And we learned as much from them as I guess, they did from using the site. That was the focus, and to respond to them, to build the site that was met their requirements was something that evolved over the few years that we did Do You. And it was a pretty rewarding experience, the whole thing. And I think that those couple of years set me up really for my entire career, really, throughout pharma, to appreciate the power of community and the importance of listening to, the end user, which in this case were, a couple of 100,000 people who wanted to review products and services in a way that they'd never had access or been able to before.
You mentioned that you're a musician. We have a lot of guests that come here from a technical or a medical or research background, but not a lot that have a creative background like you have. How do you think your experience as a creative has shaped your path in health innovation?
I definitely think it has, because especially in the early years of working in a life science company, I didn't come from the same background. People generally came from a scientific background, and I always approached things in a completely different way. They would say chaotic and disorganized, whereas, I approached it in my own way, which was, much more of a creative kind of way, which I think is now more acceptable. And things like approaching restriction and the way that we do things as a source of creativity and innovation rather than as a barrier, I think is typical for, someone who's got more of a creative learning. And also, I always try to approach things in a slightly different kind of way. So, for example, when I did social media, it was done in a visual and creative way, which was completely different to anything, that pharma traditionally would come up with.
What about your BI experience at Boehringer? What were you doing there? You said you were teaching them how to use the internet. What were some of the things that you got involved with and some of the challenges that pharmas were experiencing as they tried to grapple with this thing, I guess, both internally in terms of their systems and communication, but also externally with clients and customers and users?
Yeah, it's changed massively over the years that I worked at Boehringer, and as I moved from, different areas. So starting off in Bracknell, working in the communications department, it was to advise them really on how to use the internet. This is pre-mobile, how to use the internet to reach their target customer, which in those days was doctors. The patient didn't come into it really. And I had conversations where the number of times I heard, but doctors don't use the internet. so many times. You need to be pretty resilient. And then also from there, really engaging with the community of physicians through a company called DoctorsNet and coming up with a pretty innovative way to use DoctorsNet. The challenge I was facing was the commercial organization was dabbling. This is about 2006, 2007. We're dabbling with physician communities, and I passionately believe that they could do so much more. And so we entered into a risk share deal with DoctorsNet, whereby we did a profit split with them. So I managed to persuade Boehringer to give me a product which didn't have any marketing or sales support around it, but was still hadn't gone generic. Built a bunch of materials with DoctorsNet. Again, they use their knowledge of the community and understanding exactly what doctors wanted. And it was things like links to the Department of Health guidelines for cardiovascular products. It was, it wasn't all just product information. And that was amazingly successful. And we reached, I think it was like 27,000 physicians over the year and increased sales by over 10%. It was amazingly successful. And it ended up winning the PM Society Award for some digital thing in the UK. So that was really interesting. And then from there, moving to the head office in Germany and really kicking off their social media strategy. It was something that I wanted to do in the UK, but wasn't able to. I needed to do it at head office and had the opportunity to go there and work with some wonderful people in Germany. I learned so much about leadership there as well, as they kind of gave me just enough rope so I wouldn't hang myself. And we did social media, which to this day I think Boehringer is still pretty well known for having a very progressive, open and good social media strategy.
So what was it about the opportunity at Accenture that enticed you to leave Boehringer and go across to them?
I've been there 13 years, and it was the opportunity to work, across with different industry, different clients and different industries as well. So I was quite passionate. I wanted to see what other companies were doing, and also I had my third child was born with a condition called Cornelia de Lange syndrome, and she was born in Germany, and she got to the age of 2, and it was pretty clear that she needed more support than we could give her really in Germany. And so I wanted to move back to the UK. Didn't really want to move back to Boehringer in the UK in a kind of reduced role. So decided to look around, and Accenture were fantastic. They ticked all the boxes. And at first I was thinking Accenture, with those suits and ties and PowerPoint slides, which were full of charts and information, and not really the kind of thing I wanted to do. But I met a guy called Mark Prince, who had won the PM Society Award the year before me back in the day. And he persuaded me, that Accenture were actually going through their own digital transformation and pivoting to digital, and really when going to visit them and seeing the work that they were doing convinced me that it was the right company that I needed to go and work for.
Well, John, I've never seen you in a tie, and you've been with Accenture for almost 2 years, so you've definitely been able to put that myth to rest that Accenture is not all suits and ties and PowerPoint presentations. So Accenture is one of the top 10 consultancies in the world. It's probably in the top 5 and the top 1 in various categories. It's been 14 consecutive years in Fortune's list of the world's most admired companies. You're in 120 countries, over 120 countries, and you work in over 40 industries. We're going to dive into the details of the health tech focus that you're leading. But what can you tell us about Accenture Life Sciences practice broadly? I mean, what about the business overall, about how life sciences fits into Accenture as a business?
Like I said, Accenture's gone through their own digital pivot. We call it rotating to the new. And life sciences is definitely one of those industries where there's a huge amount of opportunity for our clients to pivot to the new as well, to rotate to the new. And if you think about the work that we're doing with open innovation in the HealthTech Challenge, which we'll talk about shortly, I think, you'll hear that we're really sort of leading the way, if you like, in helping our clients, which is basically all of the top pharmaceutical companies, with their innovation agenda, either through working with startups or through the work that we're doing here in Ireland at the dock, where we're exploring and using new technologies such as, artificial intelligence, blockchain, cybersecurity. And we really have an appetite and a license from the organization as well to be cutting edge and innovative and help, lead our clients forwards. And that's something which I really, value. I didn't want to work for a company which wasn't doing that. I didn't want to kind of throw away all the work and all the achievements that I'd done in the past. I wanted to make sure that the company that I worked for, I had the license to be able to do that.
How does Accenture define digital health, and do they actually have a separate definition for it, or do they use it interchangeably with health tech?
I think we use it interchangeably with health tech. I think our view of digital is more about the culture as much as anything. So digital for us represents change, flexibility, agility, and it's made possible by technological advances like, cloud-based computing. So, for example, we have a coalition of companies where we provide cloud facilities for them, which is not just, the ability to use the cloud, but it's very secure cloud-based services with functionality in there for both research development and clinical operations. And that's an example. So it's not sort of something we just sell company to company. It's a coalition that we created and led, and they basically own it, and we just now facilitate it for them. So it can be as broad as cloud-based, as broad as working with Viva, for which we've implemented just about every single Viva system for all the pharmaceutical companies, right the way through to open innovation, running innovation workshops. We've just done something with Biogen around quantum computing, which is in the public domain. So we managed to book time on a quantum computer and help them with their drug discovery endeavors. So it's massively broad.
So you mean that the term health tech is massively broad?
Digital health.
Digital health is massively broad.
Health tech for us is, when we talk about health tech, we're really talking about healthcare technology. We use it specifically really with the whole startup landscape. And so our health tech challenge is really about identifying those startups that we can match up and combine with our clients to help solve their problems, to help solve industry problems. And we're the facilitator in that. Our role is really to match up those two worlds. So to go back, we've been asked by several clients, as to how they could work with startups. Can we help facilitate some different some engagements with them? And really looking back at our value proposition is really to help startups reach those decision makers, which is something which I think is pretty unique to Accenture in the depth of contact that they have within client organizations. And so that's really what we try and bring to the game, really, is to help startups reach those parts of the organization that they have to reach in order to instigate true change. And then where necessary, plug in and add, and to eliminate some of the risk that may be involved with working with startups that is perceived by the life science companies.
John, tell me what Accenture is actually doing then with your clients to help them integrate technology and transform their businesses into new ways of working.
So we have client teams that work in most of the large pharmaceutical companies. And at the end of the day, essentially their job is to help clients articulate problems and find solutions for those problems. And we have 101 different ways in which we can surface and solve for those problems. We have something which we call the innovation architecture, which is a number of different services, whether that's Accenture Research. We have open innovation, which is our venture capital side of things. We have delivery centers, which is about scaling and industrializing. We have our labs, which is about experimenting with new types of technology. And we have the bit that I work in, which are our innovation centers. And our innovation centers are specifically designed to work with clients to identify or to solve for those problems. And we do that through design thinking methodologies largely. And we use a number of different methodologies, but it's largely design thinking. We use some Google processes as well. And those are all done out of or where I work, it's done out of a place called The Dock, which is in Ireland, which is a new purpose-built innovation center. And we run client workshops, client sessions, and what we do is we really try and, like I said, articulate the problem and design solutions around there, which may result in technology solutions that we build. It may result in processes that are changed. It may just be about changing the way that our clients in companies think. It may be about introducing them to new ideas that exist in other industries. So Accenture works across all those different industries, and very often it's about innovation as a definition is just as much about applying ideas from other industries, from other parts of the world into, your current industry or current business. And that's just as strong as trying to come up with new ideas as well.
John, I was going through some of the different resources and tools that were available on the Accenture website. I found a great article. I'm going to make sure I include a link to it on the show notes for this episode, on episode 35. That is the Digital Health Technology Vision for 2017, and it goes through a variety of different things that Accenture sees happening. What other great resources, what other places on the web can we find some of the materials that Accenture is making available?
Yeah, there's loads just through our website. We've got patient surveys on there. We've got the Fjord Trends, which is a really good trend analysis from our design thinking in-house agency. Well, yeah, it's their own entity called Fjord. We've got the Tech Vision, which you mentioned, and we've got lots of different points of views. So we have all sorts of different strategy papers, ranging from how to calculate the ROI of a digital initiative, right the way through to patient services questionnaire. What are patient services? What are companies doing on it? That's, there's just so much information that is pumped out by this company. It's incredible.
Yep. And you mentioned Fjord. That's Fjord. Can you tell me a little bit about how they work? You mentioned that they're sort of a standalone entity. How do they work, and what sort of benefits does that bring to your clients as you're working through some of these problems?
Yeah, well, Fjord are part of our Accenture Interactive group, which is really our experience, our design digital experience group, of which I'm part of. And they have such a strong brand, such a fresh way of thinking that we wanted to, when they were acquired, we wanted to keep that integrity of that together. So they remain as Fjord, and they have their Fjord offices. In the Dock where I work, they're part of the Dock as well. So there's quite a large Fjord team here. And in much the same way that you have other design thinking agencies out there that you can probably think of, they're up there with the big ones. And really, it's they're about, their big thing is design thinking, putting humans at the center of everything that you design, because you can design technology and systems, but at the end of the day, it's humans that are using it and humans that are interacting with it. And if you don't place them right at the center of what you do, then not only does it's not only going to be less efficient, it actually doesn't work. So this is particularly relevant to the life sciences industry, I think, historically, where we have a rich history of pharmaceutical companies building solutions, building services for patients, for doctors, whatever, but really not considering or not putting the end user at the heart of what they do. So one of my favorite quotes is, it's not building for patients, it's building with patients. That's at the heart of Fjordian thinking, to create, with humans right at the center of what you do.
We'll get right back to the interview, but first I wanted to tell you about our sponsor. This episode is brought to you by Audible.com. I know you love audio, so I partnered up with Audible to get you started with a free audiobook download and a 30-day free trial at digitalhealthtoday.com/free. Audible has audio recordings of over 180,000 books so that you and I can enjoy them when we're on the go. And let me tell you, this isn't a half-stocked catalog of classic literature. This is the latest and greatest collection of books from the leading minds of today. I'm talking about the books that are bestsellers. I'm talking about the books that our guests recommend. For example, you can listen to Sapiens and Homo Deus by Yuval Noah Harari that Liz Parrish recommended in episode 30. You can listen to 0 to 1 by Peter Thiel that Michelle Longmire recommended in episode 28. Or maybe you want to tune into The Hard Thing About Hard Things by Ben Horowitz that Yuval Moore recommended in episode 27. Just think, with Audible, you don't have to kick yourself anymore for not finding time to read, or feel badly because you keep falling asleep when you're trying to read before bed. Maybe that's just me. With Audible, you can listen while you're working out, traveling, cooking, almost anything you do, Audible can do it with you. So don't wait. Check out our guest recommendations and then give Audible a try for free. Sign up today at digitalhealthtoday.com/free. Now let's jump back to the conversation. John, I want to pick up on that point you made about not building for patients, but rather building with patients. There's a lot that Accenture's already invested in developing better ways of working to accelerate innovation in the health tech space. And I know last year you kicked off a new program called the HealthTech Innovation Challenge. Doing a program like that is a significant investment of time and resources. And I'm curious, what was the driving force behind developing the HealthTech Innovation Challenge? What were you working to achieve? And how is this program different from other programs that are out there?
Okay, fantastic question. So yeah, it is a massive investment, the amount of effort and time and the rest of it that takes to put this together. And really it all stems from a book that some of, our global head of life sciences wrote, a lady called Anna Reardon. She wrote called Healthcare Disrupted. And in there she describes how the life science industry is evolving its business models into 4 different business models. One of them which is all around new health digitals. So this is describing the process where non-traditional players are moving into the life sciences and health space. So, companies, the big companies like Google, Philips, even Facebook are moving now into the sector, and they're going to start eating away at the market share, chipping away and become competitors to life science companies in a way which traditionally they've not seen before. And then on the other side of it, you also have these new startups, led by entrepreneurs and scientists, etc., who are really trying to change things through health tech and through micro, relatively smaller solutions and startups. And again, for all of these different players, these different stakeholders to exist, there needs to be a symbiotic relationship. They all need each other really to help, and this is going to evolve into a new business model. And so, on the basis of that, and also by listening to some of the client kind of problems and challenges that they were talking to us about, we wanted to create a program which would accelerate this to help facilitate this change. And so, when we look at what our value proposition for Accenture is, it's really about providing that reach. I mean, we could have set up an accelerator. We could have given away prize money. We could have done, X number of different things, which, to be frank, already exists out there in the market. And, what value would we actually be adding to it?
John, that's actually one of the reasons I wanted to ask you about it, because it is a very different program and a very different model. And I want to make sure that people know about what it is that you're doing and how it works.
Yeah. So what we wanted to do is provide that reach. So how do they get to the decision makers? What we heard I've been in this space working with startups and health tech for a few years, quite a few years. I had, as we said before, I had my own startup. So what I know is that the biggest challenge that they have is really is getting into life science companies, into hospitals, payers, into to reach the right stakeholders, to have those commercial conversations and to describe and create partnerships is really, really difficult, because you've got to go through 20 different layers of bureaucracy. You get sidetracked by so many people, wasting time, people who don't have the budget, the understanding, et cetera, et cetera. So what we can do as a company, with our C-suite connections, is really get those people, in a room, match them up with startups, and have those conversations. And we think that is the best way that we can instigate change.
And so how did it work last year? 2016 was the first year you kicked it off. Obviously, with your role, you were right there at the forefront, putting everything together. So how does it work, and what were some of the outcomes from the first year's program?
Okay, so first of all, we opened it up for startups to apply, and we based it around some large challenge areas, which you can read on the website. But there were mainly things like, help me with understand real world data, help me have more access to medicine, help me with security. And the response that we got was overwhelming. We had, I think, 503 startups applied to be part of the program, which is a huge number of startups applied. And we held, and actually that created an internal challenge as well, because we needed to read through every single application to make sure that the ones that we selected to go through, they were given, the correct sort of due diligence. So as you can imagine, reading through quite a few hundred application processes was difficult, and we didn't give ourselves that much time. We didn't think we'd get that many applications. So I think we had about a week. And so this is where the power of Accenture really helps, is we ended up leveraging 60 people from inside Accenture to help filter and process all those applications. So each one was read at least a few times, and the ones that got through to the final were read, I think, about 3 or 4 times. And so we got the startups applying. We got, I think, 28 clients interested, all represented by at least C-suite level representatives. And so they were fantastic. They were, passionate, engaged, really excited to be part of it. And we invited them to 2 regional rounds. So one was in London and one was in New York. And at each of the regional rounds, we had 10 startups. Basically, we didn't want to do a pitching competition, because I don't think you learn too much from a pitch. And it's all based upon how well the company pitches rather than the idea they have. So if they have an off day, you miss out on a good idea. And so we did demo days. So we call it Demolition Derby. So we set up in a massive room, and each one had a stand, and each of the industry judges went in a little team with some senior Accenture executives. So these are people, with 15, 20 years in the industry. And they went around each of the stands, and they spent 20 minutes with each of the startups. They saw a demo, they could pick it up. They could try it on if it was a wearable thing. They could ask questions, and they went around each one, and they got really, stuck in and got a much deeper understanding. Of course, prior to that, they'd also had a booklet which described what the startup was doing as well. And then, then we went through a big judging process, which was quite fun and engaging, and we selected 4 startups to go through to our final round, which we then held in San Francisco. And we partnered up with Startup Health, and we were part of the Startup Health Festival, which, if you've not heard of that, it's well worth checking out online. It's a phenomenal conference that they do.
Yeah, it coincides with the JP Morgan conference.
That's right. Yeah, it coincides with the JP Morgan conference, and it's a wonderful conference. And then they pitched. They basically, at that point, all of them had won, but they went onto stage, and we didn't have that much time, so they pitched to the C-suite executives. You had CIO, the CEO, the CTO from these huge big pharmaceutical companies listening in. They could ask questions, and then we selected some winners who became our innovation champions. And it was the overall winner was a company called Quio, which are a lovely company, very well thought out, who have basically connected injectable device that you can plug a syringe into, and it tracks the injection.
What was the name of that again, John?
Quio, so that's Quio.
Quio. Okay.
They're based out in the States.
We'll find a link to that. But what can you tell me about how the companies, those winners, or any of the companies that competed? Frankly, I'm sure you gave feedback to probably hundreds of companies. Is there any specific success that's happened? We're only 6 months in, but anything that's happened as a result of those that creative collaboration and collision that was happening through this festival and through this program that we can talk about now?
Absolutely, yeah. So on the one hand, they got mentoring from Startup Health. So they really helped them with their value proposition, with their pitching material and all that sort of stuff. So they got some real, good feedback and good coaching from them. They also got that from Accenture as well. So we followed up with each one of the startups, and we did some pretty in-depth, post-event analysis with them, and helped to sort of polish what they did and give them some feedback. Then we've had some of them who have had follow-up meetings as well with some of the companies. So I'll give you one example. There's a company here in Dublin actually got through to the final called Medex Note. It's a WhatsApp, a HIPAA-compliant WhatsApp. So there's a few of these sort of companies out there who are providing a similar service, but what put them kind of above the others is they have this really cool chatbot functionality within there. So physicians, doctors in hospitals, instead of using, WhatsApp, and it's, not compliant with data privacy and all the rest of it, Medics Note is integrated into the hospital IT infrastructure. So it's all very secure, but it also, they can ask certain questions to the app and it will respond, the chatbot will give the answers back. And through the program, they've been introduced to the NHS, and they're now, I think, trialing it in, I think it's 3 hospitals at the moment in England, which was fantastic. So that was a pretty positive result from that. We've also matched up a couple of the pharma companies with some of the startups, and I don't think I can talk about who they are, but we're actively involved in that. We've run some workshops, and the focus of this next challenge is much more upon that. So the first year was more about, can we do it? Can we provide? Can we get the startups? Can we get the clients? Can we get them in the room together? Can we do the process? And the answer was yes, we can. And this next year is about, okay, let's do that, but let's take it to the next level. And there's a much bigger expectation on all of the clients now that post-event, they will be following up with the companies that they see and engaging with them and working on solutions with them.
Excellent. So let's go through some details then. So there's no cost to apply. 503 companies applied. A few finalists came out to your event that you held out in San Francisco during the JP Morgan conference, which is a fantastic conference to attend anyway, and to get involved with the Startup Health Festival out there is a phenomenal opportunity for these companies to interact with that group of people. Did you cover their expenses to get out there?
Not to get out there, but we did put them up when they were there.
Brilliant.
Which, believe you, is pretty challenging to get a hotel in San Francisco when the JP Morgan conference is on.
Exactly. So that's a big benefit. They got some mentoring from Startup Health Launchpad.
Yeah, they actually had the opportunity to join a Launchpad, but all the ones that got through were a bit too mature to join the Launchpad. So
gotcha.
None of them took it.
And they got some mentoring from Accenture executives. Well, let's talk about next year and what you guys are doing, because I know I've got the website up in front of me. What's going to be different about this year, and how can people who are listening participate in it, both from a corporate perspective and from the startup perspective?
Okay, so I think from a startup perspective, we're broadening it out. So it's not just going to be in Boston. It's going to be in Boston instead of New York. It's going to be in London again. And we're adding an Asia Pac round as well. So it's going to be in Singapore. So there's an opportunity there for the Asia Pac countries to participate, and also for on the client side of things. So we've got some big companies out in Japan. So ISAI, Astellas, for example. Those types of companies can get involved this time round. There's much more emphasis this year going to be placed on actually working with startups post-event. So there's much more focus placed upon that. Whereas before it was more about the events, really. The expectation going into it, there wasn't any expectation to actually work with the companies afterwards.
What sort of companies will the startups have an opportunity to interact with?
So the majority of the companies, I'd say half of them are life science companies. So if it's all the big ones, and there were some notable exceptions last year, of which this year has been addressed. So we're going to have some of those other big ones coming in this year. And until they've signed the release notes to say that we can publicly say who they are, I don't have that information to hand, so I can't say who they are. I think most of the companies that were in last year will be in this year. Then there are companies like the NHS and Bupa. So from the European side and from the US side, we had insurance companies, hospital groups, healthcare providers, companies like Aetna, companies like Kaiser, Fermente, CVS Health. So big organizations with a lot of to present a lot of opportunities for these startups. Any one of those would be phenomenal just to get in front of, let alone getting in front of 28 of them. I don't think there's another forum where you can get in front of such a kind of elite group of healthcare pharmaceutical stakeholders. I don't think there is another program which has the same level of people involved.
Sure. And that's a great benefit, as well as the fact that if you're a finalist, then you get out there to San Francisco during the JP Morgan conference and be a part of the Startup Health Festival. So those are great events to be a part of. I'm at the website now. The applications are open as we're recording this here. What are some of the deadlines and milestones people need to be aware of?
1st of September is the closing date. And then in terms of, you've got to just make sure that you can attend, the regional rounds. So let me think now. 26th of October is Singapore. 3rd of November is London. And 9th of November is Boston.
Right.
So you got to get those dates. And then the Startup Health Festival is, I think it's 8th of January.
8th of January, that's right. Yep. I'm sort of cheating. I'm looking at the list on your website, so I sort of put you on the spot. Well, I look forward to seeing the success again this year, and maybe get some more great quality applicants and some more engagement with some of the corporate participants and more success going. I appreciate you guys doing that and making the investment, because that is a huge cost and focus within your organization. So thanks for making that sort of innovative idea available to startups and also to corporates to help them see what sort of innovation is possible.
Absolutely, and that's what it's all about, isn't it? It's getting those two, getting two worlds to collide.
Absolutely. John, we're coming up to the end of our time together. I've got 6 quick questions I'd like to ask you. You have a few more minutes?
Yeah, sure, thanks.
Fantastic, John. What is a saying, quote, or phrase that motivates you?
So it's not necessarily, it's not a proper quote, but it's something I gave a talk on at PSFK conference, which is a New York design agency. And that's about, I truly believe that restriction does create creativity. Yeah, if you have all the time in the world, all the resources in the world, then I think that's actually a hindrance to being creative.
What advice do you have for others working to innovate in healthcare?
I think you've got to do the right thing, and you should know what that is instinctively. Don't be afraid to say no. It's not about repeating processes that don't work or continuing down certain pathways that just continue to contribute to waste or inefficiency, or processes where patients come last in the decision making. For example, at the doc, we spend more time probably saying no to things than we do to saying yes. We're not interested in projects or clients who are only interested in ticking a box or taking a shortcut to get somewhere. We want to work with clients who are truly interested in innovation and in change and improving the world. So it's about having that courage to stand up and take your own route and do things, that you instinctively is right.
What book do you recommend to our listeners?
Healthcare Disrupted by Anna Reardon. It's an Accenture book, but it talks about how the life science industry is evolving into 4 different business models. And it's the book which gave birth to the HealthTech Challenge. It's one of the models that she identifies around new health digitals. What
tech do you use that you wouldn't want to live without?
It has to be Spotify. As an ex-music journalist who used to be in a band and who I now have kids who play music. I'm absolutely passionate about music, and I love exploring and finding new bands. Spotify is I couldn't live without it.
If I gave you a check for $5 million for you to invest in health technology today, how would you invest it?
Very carefully. Yeah, can I go with a fund? And if it was, I'd probably look to be part of Startup Health's second fund. But if not, I think it's a fantastic organization that we partner with. And I've known, Unity for years and years. He's an awesome person. He's the founder of Startup Health. They're going through their second round at the moment, second fund. I don't think I'd like to name a single startup, but I love Patients Like Me. I think they're a phenomenal startup that I introduced to Boehringer, and I think they're still working with them. Quio are fantastic as winners of the HealthTech Challenge, so I really like those. There's a fantastic company which got through, which unfortunately couldn't come to San Francisco, called Brain Control, which is all about controlling a connected device through the power of your brain waves through your EG. I think they're fantastic. I think that's got to be the future of something, even if it's just teaching people how they can be a Jedi by controlling things with their brain. And then a friend of mine works for Dr. Doctor in the UK, which is another pretty cool company. So maybe spread it across those.
Well, hang on, John. It's only $5 million. Come on. You're investing in a lot of different places. It's only $5 million. Okay. And last thing, we make a contribution to a charity in appreciation of your time on the show. What charity have you selected? And can you tell us a little bit about what they do?
Yes, this one was a no-brainer for me. This is the CDLS Foundation UK. This CDLS stands for Canella de Lang syndrome, which is the genetic syndrome that my daughter was born with. And it's so she was born with several physical problems, gastro problems, heart problems, bladder problems, etc., and probably learning problems as well. So they're an organization which helps with the diagnosis of this difficult condition, which is hard to detect, from birth. And kids go through several years of living in pain. Sometimes it's not diagnosed till they're, quite mature children, as it were, 8, 9, 10 years old. And so they, really help raise awareness and education, etc. We've done, as a family, we've done all sorts of things to raise money for them. So it would definitely be them.
Cornelia de Lange syndrome. Okay, I've got it here. I will find the link to the charity that you mentioned. I will include a link to the charity in the show notes, and we'll make a contribution on your behalf. So thanks very much for nominating them and their work. What's a good way for people to follow you and get in touch and follow the things that you're working on?
I think through Twitter, through @John Pugh at Twitter is the best way, or just connect up through LinkedIn.
And you've also got Accenture Health as a handle as well. And last thing is, John, anything else that you want to say to the listeners before I let you go?
If you know people with startups, with HealthTech startups, please spread the word. Tell them to apply to the HealthTech Challenge. It's free for them to do it. It's a great opportunity for them to meet some really cool industry people from, influential companies. It could change their lives. It could change patients' lives. It could solve some big societal problems that we have. Please spread the word.
Well, there you have it. That was John Pugh, Health and Life Science Team Leader for Accenture. Be sure to apply for the HealthTech Innovation Challenge. Applications close on September 1st. Get a link to the application and check out all the links to the things we discussed on this episode by visiting digitalhealthtoday.com/35. Many thanks to our sponsor, Audible.com. Check out the book recommendations from our guests and download your free audiobook by visiting digitalhealthtoday.com/free. While you're there, take a minute to join the digital health community. It's free to do, and I look forward to welcoming you there. Tune in next week for my conversation with Mike Ryan. He's one of the most connected people on LinkedIn and a very experienced and successful health entrepreneur, consultant, advisor, and mentor. We have more great guests coming up, so be sure to get every episode by subscribing to the podcast on your favorite podcast app. Thanks for tuning in and supporting this platform. Drop me a line and let me know what I can do to make this platform most effective for you. You can reach me on Twitter @HealthTechDan or email me at dan@digitalhealthtoday.com. That's all from me for now. Until next time, keep on innovating.